everything on the screen should be page by page what you guys have in front of you. I printed it off two-sided, so it's all there. So for those who don't know, my name's Dan Garr. I own HealthQuest Physical Therapy here in town. HealthQuest has been here in Oxford for 16 and a half years already. It's amazing. We started in 2005, and you know, as y'all know, the older we get, the faster time goes. It's amazing how fast it's all gone. We've been in our new building right next to the BP station on M24 for about 5 years now, 5.5 years or so, and it's been a pretty good spot to be. Big A-frame metal roof building over there. So we do a lot of physical therapy. We do a lot of preoperative stuff. People who are going to have knee replacement or shoulder surgery, they come in before their surgery to get prehabilitated, if you will, to strengthen and stretch the muscles and tendons before they have surgery. We also have a gym that's open to the public to use to come in and work out on your own. It's not like a Planet Fitness or a Powerhouse gym. We have enough equipment to keep you busy. We have trainers there that will do one-on-one training, small group training with you. And our patients and our employees like to use the gym as well. So it's kind of full service.
Or does our insurance cover?
A lot of like the Medicares and the AARPs will cover your gym memberships at our clinic.
Silver sneakers.
Mm-hmm. Well, they do the silver sneakers now here at the senior center. We don't do it at our clinic anymore. We do that through here. Everything's in the Parks and Rec.
I was going to ask if they opened up the exercise programs or the dance programs at all anymore.
Yeah, Cindy and Michelle are doing a couple classes a week in the studio. They have a couple ladies come in, but they're doing them on Zoom too, so you can follow online. And a lot of ladies from last year who were staying home because of COVID, just like, you know what, I can watch it on the screen and do it in my living room. I'd like to do that. So we'll see where all this stuff goes, if we can get back to any kind of normalcy anytime soon. But hopefully we'll be back to doing more classes at our clinic.
You said Silver Sneakers is here now?
They do silver, yeah. Colette is the instructor. Okay. She does them here now. It's all in the Parks and Rec paperwork. So today what we're going to do, I think if I just, let's see if I do that. Oh, I got to go down. Got to do this manually. Okay. Go. There we go. So the objectives today are to introduce what are our balance systems in our body, the causes and strategies to prevent falls and why they happen, risk factors, and what therapy can do for you and what you can do for yourself as we move along. So a lot of the stuff is going to be kind of common sense, but I hope it sparks a couple things with you guys. Say, you know, I didn't think about that in my kitchen or my living room or my bathroom, to where, you know, things may fall, and some stats on why people fall and how they fall. So we'll start with the bad news first, the stats. So falls in the elderly is 700,000 to 1 million hospital patients yearly. So a lot of people go to the ER because they fall for whatever reason, getting out of bed, getting up from a chair, dizziness. More people with hearing loss have 3 times the risk of accidental falls than someone who doesn't, because when you have hearing loss, the little crystals deep inside the ear canals get off a little bit, and if you ever had vertigo, holy moly, get that, you know, it's a roller coaster of a life, and even the crystals are off just a little bit, man, you just don't know which way is up. Next thing you know, we've talked about it earlier, you know, you're on the ground. We have a couple therapists at our clinic who treat vertigo, and it can be treated within like 2 visits, teach you how to do things at home, and we clear it up really, really quickly. So if you ever have that, please call us. We can get you in and get you fixed pretty quickly, okay? Falls are the leading cause of fatal and non-fatal injuries, and seniors over the age of 60 suffer the most fatalities from falls because bodies get a little more brittle as we get over the age of 60. Now, this one, put an earmark, a star, something on this sheet. I think is the most important sheet that you have today. It's the cycle of a fall. Like why do falls happen? So let's say you fall once. Well, then that starts at the top, and then the next thing to the right of that says now you have a fear of falling again. So now you're a little more cautious. And when you're a little more cautious, you tend to be less active. And when you're less active, you have decreased muscle strength and balance. Then you increase your risk of falling, and then you fall again. So the falling starts that snowball down the hill. Like when I used to coached my son in football and baseball, and a kid was a little tentative on something. I said, look, Jimmy, go full speed. Well, I don't want to make a mistake, coach. I'd rather you make a mistake going full speed, because when you go half speed, you have more of a chance of getting hurt or failing in what you're trying to do, whether it's going for a fly ball, trying to hit a fastball, whatever it may be. So we have to keep you guys upright so that you don't get into this vicious cycle of how things happen, because we get afraid. People who are in those little fender benders or in a major car accident, they get really afraid to drive, and then they drive real tentatively, and they're the ones going 45 in a 70, and you're creating more damage or potential damage doing that than doing things you're supposed to be doing. So I like this slide quite a bit. There's a button I can push to do this, but we'll see. I'll just do it this way. Come on. Following consequences. When you have, if you have reduced mobility, functional limitations, loss of independence, you have a greater risk of death. So a couple million people fall every year. A lot of people are treated in the hospital. 1% have died for all the people that have fallen, because when you fall, a lot of times you hit your head. If you hit your head, now you got a brain bleed, or it creates a stroke, or you fall and there's a heart attack, or you break a rib, punctures a lung. There's a lot of things that can happen. So we're going to get through all the bad news first, is what we're doing now. So, you know, we'll try to keep you upright so none of this bad stuff happens to you. And we'll get into how that can happen. Leaves fall, people shouldn't, right? This time of year, isn't that funny? So we need to keep you upright. And there's ways, and some people are, when they really get weak, or they're deconditioned or inflexible, or maybe they've fallen and they're afraid of falling more, so they get less and less active. Now they're afraid to even walk, and they walk and they shuffle, or they can't pick their feet up. A lot of times I tell them, look, buy a cane. Oh, I don't want to use a cane. I don't want to have that look. I'm not that old person. I said, but you want to be that safe person. So using a cane or a walker sometimes is very, very beneficial, just to keep your balance, and it gives you another point of contact on the ground, so that your brain knows now there's 3 points of contact, both feet and a cane, versus 2.
When you do get a cane, though, shouldn't you have someone that knows the proper way to use it? Because sometimes they're either too low or too high,
Right, right.
or you're not balancing the right.
You know, and I wanted to bring a cane with me, and I forgot, but I'm going to show you this with a pool cue, okay? And you can find how to fit a cane on YouTube, Google, whatever it is.
The reason I asked this, my cousin had to revert to a cane because she, different health reasons, and she went someplace and there was a professional medical person there said you're not using it correctly. It's going to make things worse.
Correct, and it can.
That's why I brought it up.
It very much can. Very simply, the way to fit a cane, if this was a shorter cane, if you stand with your arm at your side, you put the cane about 4 inches in front of your foot, about 4 inches to the side of the foot, and let it hang to the side. The handle of the cane should be right at the bend of the wrist. That's a proper height of the cane. Okay? So 4 inches out, 4 inches over, right at the bend of the wrist, or anywhere in that area is a good height for the cane. Now the question I get all the time, I see people at our church all the time, and they're walking with a cane on their right leg like this, and I said, oh, excuse me, ma'am, I know you don't know me, but we got to switch that. She goes, oh, no, but my right leg is my bad leg. I said, I understand. That's why the cane has to be in the opposite arm. Think about how we walk. When we walk right leg, left arm, left leg, right arm. We walk like this. So if I have a bad right leg, I want the cane helping my right leg, so the cane should be in the left arm to help the right leg, to support the right leg. It seems weird, but it's always the opposite arm if you have a bad right or left leg. Put the cane or the crutch in the opposite arm, okay?
Thank you.
You're welcome.
Can you take a cane on an airplane?
Yeah. Yeah, you can. Yeah, sometimes you can keep it with you on your seat, or you can stow it upstairs. We just flew back. We were in Boston last week for our 30th anniversary. It was kind of fun. Boston's a great city. And there was a lady who came on with her husband or dad or somebody, and he had a cane, but his was actually one of those where you could break down and fold up, you know.
Are they sturdy enough?
Yeah, those are. Yeah, they hold up pretty well. And they just break by twisting and pulling, and they're all, it's like a rubber or a flexible cord inside there that keeps them that way.
You'll have to tell me all the good things in Boston because I'm going there in 3 weeks.
Really good. We had a lot of fun. American history is so much more interesting now than it was in high school. You know, we did the Freedom Trail and we did the tours and everything. It was really, really cool city. Very clean. Why the body falls. Dizziness is the leading cause. And again, if you have some inner ear issues, if you've got an ear infection or those crystals are off, that'll make you fall. Environmental, slips, trips, and falls, and physiological conditions, impaired mobility and strength, impaired vision or hearing, and an abnormal gait. Okay? So, generally with walking, whenever I observe somebody walking in the clinic, if they're a new patient, I always look at a couple things. First I see how is their walking pattern, and I look to see is each foot going in front of the other foot at about the same distance. A lot of times I'll see somebody, they'll put a leg here and they'll stop here and here and here. Not only is that incorrect at the foot and the leg, but it also affects the pelvis and the low back because the pelvis and low back now aren't moving equally with each long step. If you're stepping short with one leg, you're throwing things off in your pelvis and your low back, and that can cause more issues for your balance to fall over. So we look at a lot of things with gait. How does the body balance? Sensory input from the eyes, ears, inner ear, and peripheral nervous system. Peripheral nervous system means the nerves that we have in our hands and feet and arms and legs. Our central nervous system is our brain and spinal cord. That's in the center of our body. The periphery of our body is where the nerves come out to the arms and legs. So one of the tests I'll do for my patients, I'll have to do a balance test. I'll have them balance on one leg and just see how they do. Then they'll balance on the other leg and see how they do. And I'll say, okay, now go to the right leg and close your eyes. Now you've taken away the sensory input. Man, it is a lot tougher to balance when you don't have that horizontal view from your eyeballs. Or I'll have them maybe close one eye and try that. Big difference usually on the leg that's weaker is tougher to do. The brain interprets input, so the brain feels what you're walking on, whether it's a firm floor or a softer floor. People who go to Florida in the wintertime, I tell them, I said, if you're going to walk the beach, walk on the hard sand, not the soft sand, because it's more firm, you have a better chance of staying upright. And all that communication from the nerves come and tell the brain what's going on, so the brain knows how to move and groove. So what happens is, as we get a little bit older, the communication of the nervous system to the brain slows down. It's called proprioception. It's, in other words, that the brain knows where the arms are. Like if I close my eyes, I would know my left arm is up to my side at about 90 degrees. I can't see it, I just know by feel. The brain is telling me what it feels like, right? When you start to lose your balance, the brain is supposed to know, oh man, we're leaning right. Contract those muscles to get you upright. Well, when we're younger, we lose our balance, it's quick to get our balance back. As we get older and that nervous system communication slows down a little bit, you don't think about it until you're on the floor. It's like, how did I miss that? It's just the timing of the nerves. So you're battling age, you're battling a slower nervous system as we get older. That's why we have to be more aware of what we can do to prevent all that stuff from happening. Eyes, ears, and what we see and feel. Types of risk factors could be extrinsic or intrinsic. Extrinsic are stuff that's outside of us, like that uneven garage floor, right? Like that cord that's on from your lamp to your table and it's in the way. Like that throw rug that doesn't have a rubber backing on it and it slips out from underneath you. Could be anything like a small cat, a small dog. A lot of people trip over those things. Those are extrinsic. Intrinsic is what we just talked about. It's inside the body, the brain, the eyes, the ears. Extrinsic factors could be something simple as flooring. Is the floor smooth? Is it slippery? Is it rough? Are there raised thresholds? Is there a higher step getting in somewhere? Are your steps even or uneven? Sometimes that last step on an old house with a staircase might be a little lower, a little higher than the one before it. And your brain just went down 10 steps at a normal height, and the last one's a little bit lower. You're like, whoa, and next thing you know, bam, you're down on your face. So those are all extrinsic things, stuff that's in the house or stuff you're stepping on, stuff you can see. The stairs we talked about, lighting. Make sure you have proper lighting in your house. If you can't see what you're walking on, you can't see what you're going to trip over, and next thing you know, you're on the floor. Furnishings, apparel, obstructions, pets, cords, clutter. Doesn't take much to slip. How many years ago? This had to be 6 years ago, 7 years ago. My son was playing in a basketball tournament at a high school, and I had come from work, and it was winter, so I got to the gym, and I walked up in the stands, and I was sitting with my wife, and then I said, "Oh, my Uncle Bob is over there." So I went down the stands to the gym floor, and I turned, and I went back, wham! And I hit the back. I'm like, and I'm laying there on the floor, like, how did that happen? But my wet shoes on that wooden floor, and everyone's like, "Oh, what are you gonna do now, therapist?" I feel now. I'm like, I feel like an idiot. I feel like I'm more embarrassed than anything. But like I said, this stuff happens so fast. So shoes are going to be important. We'll talk about that in a little bit. So just make sure your house is free of clutter, and we'll talk about a few things against that. So here's that slide. So general guidelines: keep your pathways generous, keep them wide. No clutter, no loose cords. If you have throw rugs in your home, make sure they have a rubber backing so they stick to the floor a little bit better so they don't slip out underneath you. Use a walker or cane when needed. Clean, dry, hard floors. Good lighting. Stable furniture. So a lot of people, like we get in therapy, who have knee replacements and they're on a cane, they're on a walker, and they're doing well. They say, "Well, when can I get onto a cane?" And I said, if they're doing well, I'll say, start using a cane at home, not when you're outside, because you know where everything is in your home. You know where your countertops and your chairs and your staircases and things like that are. It's a more comfortable area to start using a cane. Then they gain the confidence, and then they get onto a cane when they start getting outside and coming in to see us. So knowing where things are in your house is very important so you can keep your balance. All right. Fall-proof your bathroom. Get good lighting, slip-resistant rugs. Handrails, very important. Tub and shower slip-resistant surfaces. A seat in the shower if needed. Clean, dry floors. Yep. My mom she moved into a condo a number of years ago, and she had some COPD issues and stuff, so she said just getting into those 3 steps to get from her garage into her condo, she goes, if I'm holding a bag of groceries, she said, sometimes I feel unstable on the stairs, so I bought one of those grab bars, metal one, and I put it on the angle of the stairs to her right, and she goes, oh my gosh, that's so much better. I said, make sure you tell your other 2 kids who the favorite is right now, because I just, I helped you out. But they're easy to install, easy to apply, and they definitely help. Fall-proof your kitchen, kind of the same thing. It's just a repeat of things, right? Try to make sure, like when you go from your living room to your kitchen, there's not like a raised threshold, like a difference if it's carpet to hardwood or carpet to linoleum or tile. Just make sure that it's as smooth as a transition from one floor surface to the next, because just all it takes is one catch of a toe, and down you go. Okay. Intrinsic. Intrinsic are things inside, right? Aging, lifestyle, illness, disease. Also, strength and flexibility, right? Knowing how to control the muscles that you have to keep yourself upright. Those are the intrinsic factors. So sensation, vision, touch, and inner ear, the vestibular system, like vertigo, people who have vertigo issues, those kinds of things are major. So, like I said, sometimes if you get up in the morning and the hallway's not well lit and you forgot you left the laundry basket there, that could be a problem. So making sure things are well lit, good eyesight, that kind of thing. A few more informational things, then we're going to get up and move in a little bit. So the inner ear The inner ear is like our water level in our bodies. It kind of keeps us level, you know. And so if the inner ears go off a little bit and you start to get a little dizzy, down you go. You'll see people who get off merry-go-rounds or roller coasters or rides or whatever, and they'll get up and get a little dizzy. We get a lot of patients who might be on a treatment table and I might be stretching their knee or their hip for a while, and then when they first sit up, they're like, "Whoa, I need a minute," right? We call that orthostatic hypotension. A lot of big words, right? Make you understand that. I think I know what I'm talking about. What that is when you sit up, the blood, gravity pulls all the blood from the brain down, and it takes about a minute or two for it to fill back up from the arteries. So when the brain loses some of that blood, when you first sit up, you're like, "Whoa." I'm like, "Hey, take your time." I tell them, "We're open till 8 p.m. I got all day, so take your time. We'll get you up when you're ready." And I say, "Okay, now we're good." Because if you get up and get out of bed too early and you don't have enough blood upstairs, that could be another reason why you could fall down.
That happens at a dentist's office too. I have to remind the assistant or the dentist, don't put me that way, or almost you feel like you're back on your head.
Right.
Because we're going to have a problem and you want to put me up for it.
Right,
You know?
exactly.
Yeah. And
Or put you up slowly.
They appreciate knowing that because they don't know. All
Right.
of a sudden the patient gets up and they're down.
Yeah, but I'll believe, you know, you're not the first person that probably mentions that to them. But that's good to know. Anytime you're in a position like that, laying down, even reclining in a recliner, watching TV, and you first sit up, make sure that water is level between your ears.
Does it make a difference for like somebody that wears hearing aids and doesn't have them in?
That I don't know. I don't think so, because the hearing aids just amplify the sound. The difference in the ears are the crystals, and where the crystals are in the inner ear canals, they have to be at a level place. If they're off just a little bit, has anyone had vertigo? You guys have it? Ooh, it's nasty, isn't it?
It's, just weird is the only word I can think of that.
Yeah.
Because there's no word to explain how you just don't feel it. It's not a spinning dizzy, it's just your body is
Right.
floating
Yeah.
in different directions at the same time.
Right. Yeah, and it can happen for no reason, just out of nowhere. It can just like, whoa.
Well, I was told it was the crystals. We even had crystals in the nape of
The
our
base of
neck
the skull,
there.
yeah.
And the little exercises that they gave you to do that.
Yep.
That really helped that, get
Good.
it back in alignment.
Yeah, if you can learn how to fix that yourself and catch it early, like the first sign of vertigo, and you catch it early, it's an easier fix than you let it go for a day and come in to see us or go to a doctor. It takes a little bit longer. If you ever have vertigo and you go to your doctor and they just want to put you on medications, that's not going to fix the problem. That's going to be putting a Barney Band-Aid on a cancer tumor. It's like, okay, hey, I got a Band-Aid on, I feel better. The problem is still there. The problem is the inner ear balance, and we have to get that fixed. And again, it's a very easy fix. Other intrinsic risk factors: arm and leg weakness, impaired range of motion, meaning stiffness, transfer and gait difficulties, meaning just being able to get from your bed to standing, from a toilet seat to standing, a low sofa or chair to standing. Weakness in the legs can have a reason why you could be falling more often. Postural or orthostatic hypotension, that's that thing we talked about when you sit up and the blood rushes out of your head. You just get a little dizzy for a minute or two. Other things: emotional or psychological issues, that fear of falling, that cycle of falling we talked about earlier. And if you fall once, it's going to be a number of months before you feel confident, getting your confidence back with walking. Some medications have side effects that can cause dizziness. And inadequate nutrition. The one thing, when my mom had vertigo a couple times, and she came in to see Beth, and Beth fixed her up real quick, and Beth would ask her, like, "Are you drinking enough water?" She's like, "No, I don't drink water. I have some coffee." And she goes, "Drink water. Drink more water." And she's like, "That's not going to help." It'll help. So I got her one of our Health Quest insulated, mugs with the hard plastic straw. I said, "Mom, 3 of these a day." "What do you mean 3 of these a day? I'll be in the bathroom all day." I'm like, "Mom, 3 of these a day." And she started doing that. She didn't have another case of vertigo for almost a year and a half. Just when you get dehydrated, bad things can happen. So that helped her quite a bit. Protein is another big one. We talk about protein and diet in the other 2 classes that I show here. Osteoarthritis and aging with ease is we talk a little bit more about nutrition. And make sure your calcium is up. So just off topic real quick, I was watching this video. This guy, he's a doctor in South Dakota or North Dakota, and he's talking about COVID, and he's a big non-masker. He said these masks they're, I don't want to get into all that, but he said these are the worst thing ever. He said, I'm not left, right, or center politically. He said, I've been a virologist and an immunologist for 27 years. I've seen thousands and thousands of patients. He said, if anyone tells you we have cold and flu season in the USA, walk away. They don't know what they're talking about. What we have in the United States is a lack of vitamin D season. When the weather gets cooler and we have less sun, and the sun goes more to the south and not up here in the north, he said, we're not getting vitamin D from the sun. He goes, you have to take, I think he said 5,000 international units of vitamin D per day. He goes, and I would add vitamin C, zinc, and magnesium, but vitamin D is the big thing. He said, we have a lack of vitamin D situation, not a cold and flu season. He said, if you're above the 35th parallel United States, he said, which we are in one of the Dakotas, he said, you got to load up on vitamin D. All my patients do it and they don't get sick. So go to Meijer, get some vitamin D, vitamin C, zinc. Zinc's big. I've been taking zinc for 12 years, a zinc tablet every day.
I take them all.
Yeah, good.
I don't even get cold. I don't think I've ever had flu.
Yeah, you have an armory around your body, right? Like I said, my wife has had COVID. Both of our kids caught it. I'm in healthcare. I've been diabetic since I was 15, and I've never had it. Thinking, okay. Vitamin C, vitamin D, zinc, magnesium too. So the guy was funny. He said, listen, he goes, 3 takeaways from today's meeting. Number 1, take more zinc, or take more vitamin D. Number 2, take more vitamin D. Number 3, take more vitamin D. I'm done. And he walked away, go away. So anyway, very important. Range of motion, strength, and learning to walk well are very important. When we're in PT school, we always talk about muscles having proper length, tension relationships with muscles. As an example, if you take a rubber band and you want to try to flick it as far as it can go, if you pull that rubber band way too far, it doesn't go very far. If you pull it just a little bit, it doesn't go very far. There's an optimal length for that strength of a rubber band. There's an optimal length where you're going to get the greatest amount of distance from that rubber band. Muscles work the same way, okay? If you're walking around all day like this and nothing's moving, you have no flexibility in your rib cage or arms, your chance of falling goes up quite a bit. But if you know how to breathe, expand the rib cage, keep the rib cage and middle spine, the thoracic spine moving, get some good flexibility in you, and you can walk, I'm not saying like Travolta in the movies, but if you have good flexibility, you have a better chance of catching yourself if you get out of balance before the nervous system puts you on the floor. Anybody in here do yoga? Have you? No?
I've been coming to Silver Shoulders.
Okay.
He does a little bit of everything.
Yeah. I had major shoulder surgery 2.5, 3 years ago, and the girls at work are all saying, you got to do more yoga. I'm like, yoga, forget it. Nah, I'm not going to do yoga. Well, before this past golf season, I said, I got to get a little more flexibility, and I said, okay, fine. So I went online, and I looked for a beginner 30-minute yoga session, and I did it for the first couple times, and short of me screaming at the girl on the screen going, how do you do that? How do you get there? My wife's laughing at me. After about 2 weeks, I said, dang, I feel pretty good. And so I had to tail between the legs. Okay, ladies, you guys were right at work. We told you. So my sport is golf, so I played a lot of golf this summer. I'm kind of looking forward to the end of the year so I can get back to doing my yoga at home. I've never thought in the world I'd say that, but just simple yoga. And you can find videos online. You could do it sitting in a chair, sitting on a couch. You can modify it to be as aggressive as you want, as little or low aggressiveness as you want, but to learn how to breathe, how to move, how to reach, how to stretch, to get that optimal length-tension relationship in all of your muscles so your rubber bands work the way they're supposed to work. Not too little, not too much. So, highly recommend that. I would also incorporate something for like the emotional side of things, whether it's the easiest way to know if your muscles are warm enough before you stretch, and falling is all about some bad stats. Now, what are you going to do about it? Back extension is this motion, but then we're going to give you the tools of what to do at home. That's where the rubber meets the road. Okay, now with the band around your knees, sit there. Before you stand up, spread your knees apart just a little bit. We have them walk and we just have them turn their head side to side and see how their balance is.